Hello. So we've been discussing um, possibly having some sort of um, training and maybe even certification for people who want to just better know how to deal with a mental health emergency, um, kind of like a mental health first aid type thing. Um, so Unfortunately, the vast majority of mental health first aid, what's called crisis counseling, is actually not delivered by professionals. First of all, because frankly, I mean, you can easily train someone um, to do that type of work, um, actual crisis counseling, um, without without a lot of training and understanding. I mean, um, it's kind of, in a sense, similar to somebody's bleeding, and you're like, well, try to stop the bleeding. Not too much beyond that. But at the same time, there's a lot of discussion, and unfortunately, there are people who will go so far as to assert that there's no such thing as mental illness. Um, and I mean, I've seen people, especially some religious conservatives, including reformed, Presbyterian types, um, say that there is no such thing as mental illness. There's spiritual possession, and there's sin, and that's it. Um, And I have to say that these people obviously have not spent enough time with people who are actually really mentally ill. Um, I'm gonna be doing my internship in a locked ward. I don't know if you've ever been to a locked ward, but people who are in a locked ward, I mean, some of them at the very least are very obviously in great distress, and there's a real illness there. You can no more deny that level of mental illness, what we call persistent severe mental illness, um, then you can you can ignore somebody just like bleeding all over you, right? um but there are degrees of mental illness, just like there are degrees of physical illness. And really, um, pretty much everything that we have from um, good mental health comes from, uh, in a very real sense, following the medical practices regarding physical health, right? And a lot of similar concepts do apply, even though it's not so obvious. And culturally, unfortunately, what's happened is that we have a lot of pop psychology. We have a lot of people diagnosing other people with mental illnesses. We have a lot of psychological self help, which can be useful, um, but at the same time, and including just un non-professional psychodynamic um, interventions, which frankly some of them are very good, and for the right person they can be incredibly effective. And this is especially the case, I mean, when it gets to good morning, Hazi. Especially when it gets to um, people who are counseling people, or so I recommend thinking about mental health in a very similar way as you imagine physical health, right? So there's something that paramedics, EMTs, right, emergency medical technicians, are competent and capable to do. And in a very real sense, crisis counselors are like EMTs. They know first aid, they do basic things, right? And that's very useful. And frankly, I think if we do end up having some sort of certification, the way I'm thinking about it is Mi Rofel Shvurei Lev, very important. Who is a healer for those with broken hearts? Um, well, I mean, yeah, and that's, I mean, um, there's a difference between mental illness and just the normal cycles of human emotion. In fact, one of the signs of mental health illness is that a person doesn't have the normal signs um, of emotion. Look, if God forbid somebody who is close to you passes away, yeah, you should be sad. That's the normal emotion, and you go through a mourning period, right? But when that goes beyond what is um, a, a normal mourning period, it can be a problem. And when it doesn't happen, um, it's 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 going to affect you. And one of the things that does happen is, so we rationally convince ourselves that something should be in a certain way, right? Oh, I don't care if so and so said such and such, right? And then um, we find ourselves crying, right? And you should pay attention to your body when you start crying, right? Or having a panic attack, hyperventilating, right? This is your emotional system telling you that there's something wrong. And this is oftentimes the intermediate level of of mental illness, right? It's not something that's like a persistent severe mental illness. Um, it's something that is bothering you at the time. So Viktor Frankl gave an gives an example of somebody who came to him for logotherapy, who was a diplomat from Britain. If I'm remembering the story right, it's in the towards the end of his book, "Man in Search of Meaning." Um, and so this diplomat from Britain to I guess Vienna or Austria, um, Geneva maybe, I don't remember, wherever Viktor Frankl was, had been depressed, and was going to therapy and was doing psychoanalysis, which is one form of mental health intervention. Um, by the way, I'm having a discussion on Wednesday for 2 hours with Dr. Lockwood, who I saw on Twitter. Some of the people I follow also follow him, but he was explaining things very rationally and well to Matt Walsh, who is doing the hot takes a lot of people do about psychology and mental health. Um, and so, at least some of this stuff is stuff we're going to be talking about. I'm going to be talking about with him. But just in general, yeah, there is such a thing as mental illness, and unfortunately, I would say for political reasons, there's been this postmodernist turn to completely negate mental illness. It doesn't actually exist. Lots of people who are big fans of Dr. Zaz, SZ, I think is how you spell him, his name. And frankly, I have to say that Zaz himself quite likely would say that the issues that he was bringing up from 50 years ago um, were largely addressed, and the people who are claiming to be his disciples are not uh, are taking things too far. He himself was a psychiatrist. There is such a thing as actual mental illness. I don't. I mean, it's crazy that we have to say this, um, but um, just like you have some people who are diabetics and they have a natural propensity to have certain illnesses, you have people who have certain emotional frailties, and they're more likely to be um, to have emotional fluctuations, um, which can, in its worst manifestations, be bipolar, right? Manic depression. Um, there are people who are naturally given to depression. And frankly, some people are just so physiologically predisposed to depression that it might make sense for them to be on psychotropic medication for long term. The but the reason I was telling the story about this guy who was having psychoanalysis is he went to Viktor Frankl, and Viktor Frankl told him, "Well, no, the problem is you don't like your job. Just change your job." Right? That's like digging into your childhood for 5 years is not going to change the fact you don't like your job. You don't find it to be meaningful. You want to go back to Great Britain. You don't want to be living here as a diplomat. Um, and so, um, so I mean, Jordan Peterson gave what I think is definition of the best definition of mental health. He said, "Mental health is the harmony of your existence in relationship to the future and other people." Again, mental health is the harmony of your existence in relationship to the future and other people. And I think that's about as good of a definition of mental health as you can give. um, Harmony, right, between you and your future, between you and the people around you, and between you and the people around you in the future, right? um, and so if you cannot coexist, if you cannot live, certainly with yourself, right, um, but with other people, then there's something wrong here, right? That there's a dysfunction that needs to be um, addressed. And sometimes the way to address it, um, I was at Lord of Spirits convention a few years ago, and Father Stephen said this. Um, Look, if you're in constant pain, you're going to be depressed. That's just a normal reaction to being in constant pain, right? And maybe what you need to do is go to the doctor and deal with your physical pain, right? And I mean, in psychology, what we talk about is the biopsychosocial, right? Biological component, psychological component, social component. Some people will add a spiritual component, which I think is actually appropriate, right? Um, but there's a level of mental illness that's very real. That's so real that even the people who say the silliest things will, if when faced with it, they will realize, oh, no, 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 this is just mental illness. And while psychotropics can help people break out of some of those patterns, right? Your your body is self-regulating and will attempt to get back to normal. And if you are stuck in a situation where, um, I mean, if you're wearing shoes that don't fit, don't be surprised if you get calluses. If you are in a place where you are being emotionally abused or not meeting your mental, your psychological needs and your social needs, actually, you're going to start having symptoms. And different people will have different symptoms because different people have different reactions to things, right? We're not dealing with simple A leads to B, right? The fact is that there are some people whose reaction will be one thing and some people another, but there are patterns which we can recognize, right? So again, going back to the medical um, way we look at it, there are cases in which you need a paramedic, right? You need first aid, you need, and then there are cases where you need surgery or you need a doctor to prescribe medication, um, or you need bed rest and time for your body to heal. And there are certain conditions which you have to learn to live with, right? Um, a person who has a propensity to be diabetic has to be able and willing to try to address that propensity through diet, exercise, and if necessary, medications, right? So, what is the role of somebody who's not a professional? You're not going to become a doctor. You're not going to be doing psychological interventions on people in helping maintain a normal level of um, psychological mental health. There's a large role, just like personal trainers have a real role in helping people exercise, just like nutritionists have a real role in helping people eat uh, well, and frankly, avoid poisoning themselves with the foods that they eat. And just like communities have will disseminate knowledge to people about what are common conditions, right? And how to deal with them. Similar things can and should be true of mental health. And one of the things that we are hoping Fountain of Comfort will be is as a resource for communities to be healthy together. And so part of that is one of the programs that I've been very excited with and I would like to make happen is peer counseling, is people who just generally are aware of, okay, this is a sign of mental illness. This is something that maybe I should talk to a professional about. Um, this this is the type of thing that isn't really mental illness, right? And um, it's so this is the Diagnostic and Statistical Manual. A little knowledge is a very dangerous thing. A little knowledge is a very dangerous thing. And in a similar manner as if you teach people, um, if you teach people first aid and someone's having a panic attack and suddenly, somebody tries to do the Heimlich on them, not a good idea. You could crack some ribs. Pop psychology can be very, very destructive. Suicide contagion is a real thing. Um, mental illness, psychological dysfunction can be socially contagious. Part of that comes from just generally the fact that we learn how to act and react by learning it modeled by other people that we see. So if, and unfortunately this sometimes happens, society teaches people that a normal reaction to your spouse leaving you would be to commit suicide, then in that culture you are going to see more suicides, right? And that's unfortunate. In a healthy society, hopefully, there are all kinds of prohibitions about suicide, and it is not it is never thought to be an acceptable a reasonable reaction to pretty much anything to commit suicide. But if you do make it, I mean, again, this gets into Judeo-Christian values, because societies which don't have the Judeo-Christian values that we in the West are used to, did, and they exist, societies which have suicide rituals, etc. Right? So cultural norms do play into this. And part of the problem has been dealing with a society, a secular society, with the fact that some of these norms about when exactly it is okay or not okay for a person to kill themselves, it's a judgment. Now, in counseling, one of the things that are very important is what's called Rogerian positive regard, unconditional positive regard. So when you go to a therapist, the therapist is supposed to greet you with a truly loving, actually, stance, which is why I was once talking to parents of someone, and I said to them, well, you know, I have to um, I have to have a certain amount of emotion, of judgmental distance, right, and positive regard and encouragement in the relationship that I have with someone who comes to me for counseling. And the parents said, "Oh, we're trying to do that too." It's like, no, no, you're parents. You're not counselors. In one of my classes, one of the students said to the professor, "Yeah, I've been trying to do what we do in regarding like all the things that we're learning about counseling skills. I've been trying to do it with my wife, and she just gets really mad at me and says, 'Stop trying to counsel me.'" It took us a while to explain to him, dude, no. Like, that's um one of my rabbis once said this, and I really appreciated it. He said, "It is, you should never ever go around with a sharp knife, cut into people's chest, and cut their beating heart out of them, unless you're a heart surgeon." And what a lot of people don't recognize is that a true psychological intervention, right? Actual therapy is not um, sitting there talking with your friends. And this is one of the reasons why um, life coach as counselor is, unfortunately, um, there's been a lot of confusion about where the role of pastor, the role of parent, the role of coach, and the role of mental health psychotherapist have gotten confused with each other. And these are distinct things. And yes, there are edge cases which deal with all of them. But ultimately, one of the values of peer counseling, one of the reasons um, group therapy actually is, things can be done within group therapy that would take years of individual therapy to complete. Yet there are things that require individual therapy. And part of the reason for that is that in group therapy, while you have a therapist who's facilitating the group, you have peers, you have other people there who can say things that a counselor simply cannot say. One of my professors was giving us an example of a case where he had a difficult time having Rogerian positive regard for, comes from Carl Rogers. That's why it's called Rogerian. For his client, he was talking to a woman who was a meth addict, and she was pregnant, and she was continuing to use meth. And he was trying to explain to her that if he continued to use meth, her child could be seriously impacted by that and could have a lot of serious developmental issues. And her response was, yeah, but then I'll get more money. And he said, at that moment, I, you know, I had a very hard time not judging her. A friend of ours that many of you know is works in forensics, and oftentimes is dealing with truly heinous crimes, and child molesters, et cetera, et cetera, et cetera, right? And his role as a therapist is to continue to have Rogerian positive regard for the client while that client is in therapy. That's only in therapy, right? This is not something that should escape out of the therapy room, right? That's the equivalent of putting strong antibiotics in the water. You don't want to do that. You will make people very, very sick if you put strong medication in the water and everyone drinks it. And in a very similar manner, a lot of things that are psychological, that are appropriate in a therapeutic professional mental health relationship, have started to become either communal standards or how people deal with each other. It's pop psychology in the water, and it is very, very harmful. And so one of the first things about having a peer counseling relationship is to recognize the importance of lay counseling, of people learning psychological first aid and knowing, okay, this is psychological first aid. This is not how I should deal with someone who's not in crisis. And if this person needs therapy, then they're going to need to go to someone who has been duly licensed and duly has that relationship, right? The counseling relationship cannot be, there's a reason why you can't give therapy to your family members. It doesn't work. In fact, it's it's worse than operating on your family members. There's some chance that if you're the only one who, you're the only heart surgeon, that maybe you should operate on your family members. But that's not the role of a psychological first responder, of a crisis counselor, of really, I mean, even a coach, a mentor, a pastor. That's not what you're supposed to do, right? So that's the first real lesson, is there are different levels of psychological intervention. There's different levels of assessment, and there's different roles that different people play. So when you see someone in physical distress, someone is bleeding, right? You recognize that there's a role for somebody who has first aid training, to take first aid training. Then there's a role for somebody who's a trained paramedic who may know more interventions. Then there's a role for someone who has the level of training of a nurse or a nurse practitioner or a physician's assistant. And then there's the role of a physician. And then there's the role of a surgeon. And psychodynamic interventions are like surgery. And like I said, unfortunately, some psychodynamic interventions are actually being done because it's very hard to stop people from doing this, being done by complete laymen in completely non-clinical environments. And some of them are actually very good and appropriate for some people. In a very real sense, I would say that that's, for example, what Alcoholics Anonymous can be, is surgery. And because it is a community which has been formed around doing this, and frankly, they came up with the intervention, one of the first, if not the only, real intervention that helps alcoholics. It's become part of our society. And for the right person, it is incredibly helpful. Incredibly helpful. My big I don't even know what to call it, but what the danger I see is we have a large number of people who imagine that what is good for one person is good for all people. And one of the first things that I think an intelligent nutritionist knows is different people have different nutritional requirements. Different bodies absorb different nutrients at different rates, and people with different genetics and different just physical conditions and environments need different diets. And similarly, I mean, if you were go to a pharmacy and the pharmacy had precisely one prescription, right? Regardless of what prescription you brought, they gave you the same pill, right? That would not be a good idea. Similarly, in mental health, the exact same prescription is not good for every single person. And frankly, one of the reasons I'm totally staying away from the Diagnostic and Statistical Manual and talking about specific diagnoses is that it's not useful for somebody who's not actually doing psychological interventions, right? It's not part of first aid to know this person has a compound fracture or, something that frankly you would only be able to see with x-rays or, some level of expertise about what particularly type of infection this might be, right? First aid is first aid. And so the first thing I would say is to recognize that, yes, there is such a thing as severe mental illness, which can be persistent, and to recognize there's such a thing as being in psychological crisis, which may be a manifestation of persistent mental illness, but sometimes is not. And then there's something which is healthy, right? So one of the ways I make this clear to people is generally if I'm having some sort of internet discussion, is I show them a picture um, of Arnold Schwarzenegger during his Mr. Universe phase. And I ask them, is this a healthy body? Is that a healthy body? I'm pretty sure he's admitted he was taking all kinds of steroids. He was spending very large amounts of time exercising, as you have to do to be a bodybuilder on that level. So is that healthy? Is that our model of health? Well, similar things can be true of psychological resilience, right? There are people who have trained themselves to be quite stoic in any situation. And if we place that as the highest degree of mental health, right? This person would never be traumatized, would never start crying, would never panics, never emotionally gets down. It would be like taking a bodybuilder who almost inevitably is taking testosterone or some other performance enhancing drug and spending what I would say is generally unhealthy levels of time and transferring it to the mental health situation. So what does mentally healthy look like? It is definitely more vague than what physically healthy looks like. What does psychological crisis look like? You generally will know it. People will have very intense reactions. They may be crying. They may be shifting their way of talking. They may be obviously not making any sense when they talk. Repetitive action can be a can be one of the reactions. But psychological crisis, as opposed to persistent severe mental illness, right? The Domaharon. As opposed to just an emotionally difficult time. Right? One of the things when I talk to mental health counselors is the fact is, unfortunately, the way the system is set up, you can do incredibly difficult psychological work with people who don't have much money because they are in psychological crisis. It's incredibly difficult, generally very low paying. Or you can, unfortunately, something that has become a part of real life is that people without persistent severe mental illness will end up in years of therapy, years and years of therapy. That's generally not advisable for most people, but it doesn't exactly hurt. But then the therapy, it devolves into something that is not genuine therapy. It becomes more of a coaching relationship and more of a simply, what did the good Dr. Lockwood call it? I think I retweeted it. Let me find out. It was something like distributed cognition, but that wasn't the word he used. It here. Let me say this as clearly as possible. The best predictors of efficacy in psychotherapy include: 1, the quality/strength of the therapeutic alliance; 2, capacity for therapists to help patient increase what is called metacognition; 3, degree of social support; 4, frequency of sessions. For general factors, for specific disorders, there are other specific predictors. And then he, I mean, the discussion with Matt Walsh went a little off the rails. So the goal of having peer counselors, and that's the best term I could find for it, is to have people within our communities who are the equivalent of personal trainers, nutritionists, and EMTs. Meaning that they can recognize when there is a problem requiring professional assistance by somebody with a greater level of training, someone who can actually diagnose, right, the mental health problem, right? What would you think of a nutritionist who was making medical diagnoses? That's what you should think of a peer counselor who tells you that you have bipolar or schizophrenia or any of the other names that people, it's become very common to call people narcissists. Narcissistic personality disorder is actually in the book, and it's rarely, if ever, diagnosed because there's no point in diagnosing narcissistic personality disorder generally, because a person with narcissistic personality disorder will not come to counseling. And they will reject such a diagnosis. Which is another problem with counseling, is that The people who go to counseling tend to be a very specific type of person. And so, um, the experience of clinicians tends to be solely with those people. And um, that has unfortunately taken over way too much of our time talk, talking about mental health. When you deal with a whole community, right, you're actually going to get all of the various um, mental health problems. And so, for example, it's very common assertiveness training and dealing with um, irrational and dysfunctional guilt is something therapists are always dealing with. There's a reason for that. The people who end up coming to therapy are people who have trouble with asserting themselves, with self confidence, with self worth, and tend to have dysfunctional and unnecessary and irrational guilt and shame. That does not mean that there aren't people who need to feel more shame, who need to feel more guilt, who need to feel a little bit worse about themselves. And if such a person was willing to have therapy, that therapy for that person would look very different. And one of the ways that hopefully we are here at Fountain of Comfort, we are improving things, is that part of the problem is if mental health interventions are only available to people who can pay for it, A, people who can pay for it, and B, people who are willing to pay for it, you get all of the distortions that we have in our current mental health field, which includes people with what can be called as transitory or even minor mental health issues, having very expensive and very competent therapy for many, many years, sometimes when they really shouldn't be. And unfortunately, there are predatory therapists out there who do take advantage of that. And then a lot of people who do need the help and refuse or can't afford the help don't get it. Which is part of what we are hopefully doing here at Fountain of Comfort is we are being a free public resource for communities. Um, we are going to help educate entire communities and leaders of communities about actual mental health. We are going to have people who can be trusted to ethically and competently exercise professional um, provision of um, therapy. And we're going to help educate and train peer counselors who can recognize that um, there is a place for counseling that is not therapy. Counseling doesn't need to be therapy. And like I said at the very beginning, the vast majority of psychological counseling is actually provided not even under the guidance and supervision, which frankly I think there should be some guidance and supervision of counseling by professionals. Unfortunately, much of it doesn't even have that. Um, I'm gonna probably stop in another 5 minutes or so, unless there's somebody out there. There's only a few people watching who wants to jump on and discuss these things a little bit more. But this is important stuff, and what I'm thinking in terms of having a peer counseling session certification is maybe having a 100 question test that anybody can take that is extensive enough that, I mean, if you know the answers, you know the answers. And allow anybody who wants to take it and to get certified as a peer counselor. And then go through the questions. I'm thinking like 100 questions. Go through the questions, explain the reasoning behind it, and so what my recommendation would be is to take the test cold, see how you score, and I mean, if you get a very high score, that's great. But if you don't, then watch through the explanations and finally take the test and pass it. And this is where I'm supposed to ask for money. Money would help. So donate to Fountain of Comfort. Like, subscribe, all of that jazz. Because ultimately, the hope here is that we're going to have a new model, a better model, where the people who are receiving mental health care are not the people who are paying for it. And that is the whole point of having a board of directors, et cetera, et cetera, et cetera, so that we can help provide people with the things that they need without charging them, without money being a perverse incentive to keep people, to give therapy where it's not most needed, and not to give people the right type of therapy that they need. So please comment, especially if you are interested. I mean, I am willing to do the work and put together the test, et cetera, but I need to know that there are people who are actually interested in getting peer certified, and I mean, comments, questions, et cetera, are very welcome. Okay, I think that about does it. Have a good evening, people.